Hi, my name is Patrick Williams, and I'm the founding member of One Vision, a company providing employers, brokers, and consultants with tools such as benchmarking, RFI, RFP, and education solutions in order to maintain compliance with the Consolidated Appropriations Act. We'll be recording a series of videos discussing the Consolidated Appropriations Act, which was passed December 27, 2020. Today, I'm joined with Jamie Greenleaf, founder of Tilt. Her company is dedicated to solutions providing transparency in healthcare at the employer-employee level. Prior to starting Tilt, Jamie managed Greenleaf, and she has over 30 years of fiduciary experience in the mid-market space. Welcome, Jamie.
Thank you.
Today, we'll have a discussion with two of America's leading attorneys when it comes to ERISA. First, let me introduce to you Karen Handorf, and she is senior counsel at Berger Montague and a member of the firm's employee benefits and ERISA practice group, where she represents the interests of employees, retirees, plan sponsors, plan participants, and beneficiaries in the employee benefit arena. Welcome, Karen. We also are joined by Julie Selesnick, and Julie is also a senior counsel member of the Berger Montague law firm and a member of the employee benefits and ERISA practice group, where she represents employees and retirees and plan sponsors and plan participants. Welcome, Julie.
Thank you.
Today, I want to start off our discussion with the first question, which is, as of 12/27/2021, what are the three most important things that employers need to know about the Consolidated Appropriations Act, and is it going to go away?
All right, I'll take the first part of that. The three most important things that employers need to know about the new requirements under the Consolidated Appropriations Act are that in less than a week, they have several immediate obligations that they need to be in compliance with, that there are many deferred obligations that they need to get in compliance with over the next 12 months, and that there are new attestations required for some of these new regulations where the employer is going to have to send an attestation to the Department of Labor that they are in compliance. And failure to do so will open them up to, possible DOL enforcement action, fines, penalties, and even litigation. Some of the more important things that employers need to be ready to go in less than a week are first, removal of gag clauses. That was supposed to be done a year ago. I don't think it has been, but if you have an ASO agreement, or you should check all of your service provider agreements. If there are gag clauses in them, they need to be removed. That law went into effect actually December 27th, 2020, but it's certainly by 2022, attestations are going to have to be filed by employers that you did have these gag clauses removed. There are also broker and consultant disclosures that go into effect in less than a week. And we're still waiting for some agency guidance on who exactly needs to make these disclosures. But so as of right now, we would advise employers that, all of your service providers need to make these compensation disclosures until you learn otherwise. And those disclosures, that's how employers can now judge reasonableness under the plan if the costs are reasonable. And employers have an affirmative obligation to seek out these disclosures if they're not provided. And if they then are ignored, they have to report these to the DOL. And failure to report could, again, expose you, the employer, to liability under ERISA. There are also a host of deferred regulations that there's no time to get into now, but over the next 12 months, there are more things that employers need to do related to mental health parity, medical and drug cost reporting, and advanced explanation of benefits, as well as medical and drug cost reporting and price comparison tools. So that should be on everyone's radar. So Karen, I turn it to you as far as what you think these requirements, if they'll go away or how they'll be interpreted.
Well, I don't think that they'll go away, number one, because really what they do is they give employers tools they need to do what they should have been doing all along anyway. And that is monitoring their service provider to make sure that their agreements are prudent and that they are not paying more compensation than they should be. The prudence standards of ERISA require them to do so, and all contracts with service providers are prohibited transactions unless they meet the requirements of an exemption. I think it really is a signal to employers to wake up, because I think employers have not been taking their healthcare plans seriously like they do their 401k plans or their pension plans. And these rules kind of mimic the regulations that the Department of Labor issued with respect to 401k disclosures. And they allow you to tell your service provider they're obligated to give you this information. It's not going to be enough that they just give you the information. You're going to have to actually use the information to figure out whether, in fact, your contracts with your service providers are reasonable and whether the compensation you pay them is reasonable. And I think that not only will private litigants be more attuned to these issues, but certainly the government will be as well.
Thank you. As I stated before, we'll be creating further videos exploring the ramifications of the Consolidated Appropriations Act. Thanks for your participation today. Be sure to follow us on LinkedIn at One Vision Analytics, or our website at www.1v-a.com, or Berger Montage at bergermontage.com. Thanks again.